Hi friends. So I'm sharing my PM skincare routine. I'm Neha and I'm a yoga teacher, but I'm making a skincare video because a lot of my friends keep asking me what do I do for my AM, PM skincare, hair care, body care. So I'm done with the repetition. So I felt that it is wise enough to make a video for all, and this is also a way I can share what I do for my skin. Now anyone who has dry skin or is of an age of 35 plus can follow this routine if there is no other skin complication like severe pigmentation, open pores, sensitive skin, extremely oily skin, combination skin. It's only for dry skin with no much complication. I don't have any such complication except little bit of darkness under my eyes, that is because of the spectacles, and very mild pigmentation on my face here and there. Otherwise I don't have any problem. My skin is pretty much uh, able to take everything, so it's not at all sensitive and complicated to handle. So this is about my skin. Now without any further ado, let's get started. So yesterday I had shared a video which works on brightening the skin. So the PM skincare is divided into three: brighten, lighten and tighten. So Monday and Thursday is my brightening nights, Tuesday and Friday is my lightening nights, and Wednesday and Saturday is my tightening nights. So this is an anti-aging skincare routine where we are working on brightening, lightening and tightening the skin. So today is the day for lightening. So this is PM skincare part 2, you can say. Part 1 I shared yesterday. So the first thing I did was washing my face with a gentle face wash. So I always talk about basics. So basic number 1 is you can go for any face wash on the face of earth where it is a gentle or mild or anti-aging or a face wash for dry skin. So after 25 years of age, you should go for any face wash which is gentle or mild or anti-aging in property, or which is for dry skin. So any dry skin face wash will not have exfoliating ingredients like salicylic acid, AHA, BHA, lactic acid and all these things. So the safest rule number 1 for basic choosing your face wash after the age of 25, irrespective of what is your skin type, is going for this kind of face wash, not necessarily Clinic, any brand, unless your skin is extremely oily and that's the biggest problem you want to handle. So not for them, they can go with whatever their dermatologist suggests. Now I always double cleanse my face. So before this I had used this cleansing balm from Clinic. You can go for any oil based cleansing balm. Remember, it is not necessary to have a makeup on to double cleanse. You should ideally double cleanse your face whether you're wearing makeup or not. So first double cleanse with any oil based cleanser, and then face wash using any gentle face wash. Now after this we'll go for toner. So the rule number 3, the basic rule for toner is going for any gentle hydrating toner. It should not be exfoliating in character. Same AHA, BHA, lactic acid, glycolic acid, salicylic acid, all these ingredients should not be there in your toner. It should be a gentle hydrating toner. When I'm talking about a toner which you use regularly. So today I'm using Kama Ayurveda Pure Niroli water. So this mist I'm using it as a toner. And a quick tip, especially in summers, put your gel based products, whether it is a eye gel, face gel, gel pack, gel mask, sheet mask and toners, aloe vera gel, all these things in fridge. They work really better when they are cold. Now after this, meanwhile my toner is getting absorbed, I will go for a step for my lips. So I'm following a lip care regime. So for which I needed a retinol eye cream to lighten my lips. So I am using a Pilgrim retinol eye cream on my lips, very little. So I'm like this, I'm spacing out my skincare. Meanwhile, the toner is getting absorbed. If I'm in a hurry, I can use a fan also, but today is fine. Now, so I will make a separate video for lip lightening, area around eye, or let's say body care, or hair care. So I'm trying not to complicate and stick to the basic skincare for PM. So remember, today is the day of lightening. So for lightening nights, I use alpha arbutin. This is to lighten the skin, even out the skin. This is the first serum which goes on my skin. Now, whenever you are new to any serum and you're not sure about it, two things you should follow. Avoid eyes, area close to your nose, lips, and avoid applying your toner on a soggy skin. When you want maximum absorption of a product, now for example, I'm seasoned, my skin is used to all these serums. I want maximum absorption of the skin. I am not scared of any allergy or reaction. So I will use it on a soggy skin. So I'm using it on a soggy skin. Upward movement, covering my lips, neck, chest, and back of the hands. So alpha arbutin I'm using from Neemly. This is this is from Neemly. You can go for any alpha arbutin. Remember, you should always start with a low potency serum. For example, you are new to alpha arbutin or niacinamide or vitamin C, go for 5% and then gradually move to the higher concentration. Now after this, the next step is my niacinamide. I'm going for 10% from Dr. Shet. You can go for 5% if you're a beginner, any niacinamide. Second layer, covering my lips, upward movement, covering my neck, chest, back of the hand, and the leftover goes on my ears. Now, as I have discussed it yesterday, this is a ointment suggested by my dermatologist called as adapalene gel, adapalene. So this is a kind of a retinol which works on reducing the frequency of blackheads around the lip area. So I just apply it on the corner of my lips because this is where I had a problem of blackheads, which was distorting the shape of my lips because I was picking them out. So this is what I apply. This is just optional. If anyone has a similar issue, then this is a miracle product. Now these are treatments, okay? Niacinamide and alpha arbutin is a treatment. So treatment is never a last step. So the last step is always hydration. So at night I use any moisturizer which has ceramide. Here I am using Dot & Key ceramide and hyaluronic acid skin barrier repair face cream. So sorry, this is the moisturizer covering the lips, and upward movement. Few good massaging steps are knuckles up and down, up and down, knuckle up and down, up and down, working on the wrinkles around my, these are the areas which tend to age faster, show the fine lines, wrinkles faster. So you can always work around these areas like the crow's feet. You're stretching the skin around on the lateral side of the eyes, and then upward, covering the neck, chest, back of the hand. The remaining goes on the ears. Now the way after treatment we seal the face, now we will seal the lips because the retinol eye cream on lips was a treatment. So we always seal the treatment with a hydrating moisturizer. So this is Dot and Key lip plumping sleeping mask, which is the most reasonable sleeping mask on earth with plumping property. Plumpers are very expensive. So this is a big bottle with a flat base, you know what I mean, with a flat base. So this is huge. This is I think 8 to 10 months old, and I have just reached the neck. This whole round thing is full of this product. So this is the cheapest plumping. I'm obsessed with this. I use it. I use it like a lip balm. Unless I'm going for a treatment on my lips and I want the ascorbic acid on my lips, or the lightening, melalumin, something like that. So unless I'm giving a treatment to my lip, the other times I use it as a lip balm. This is amazing. In fact, all my other lip balms are not being used since the time I have got this. Okay, now we cannot forget the eye area. So this is a 3-in-1 eye product. I think I forgot to mention the details yesterday. So this is by Plum Mandarin with 3% vitamin C, 3% peptide, 3% caffeine. So it has got everything that works on puffiness, dark circles and under eye wrinkles. So this is amazing. Like if you don't want to apply 10 products on your eyes or around your eyes, this little goes a long way. Just this much, and apply it with a gentle massage. Do not put pressure around the eyes. The product should not enter your eyes. When you're applying treatments on your lips, the product should again not go inside the mouth because they taste really gross. Now I prefer a thick product around my under eyes because my skin is very thin, and whenever my skin around the eyes is dry, I tend to scratch my eyes, and I'll rub my eyes, which is really the worst thing you can do to your eyes. So I prefer having a thick cream around my eyes. So the way there's a balm, the last thing on my lips, a heavy cream on my face, similarly a heavy eye cream around my eyes. So this is Damask Rose and Coffee organic eye cream from Juicy Chemistry. This is for dark circles and it deeply nourishes. So this is very thick, very oily, and little bit goes a long way. So I have hardly taken a drop, not even a drop actually, only this much of the product. I don't know if you can see. So going for the gentle application around the eyes, carefully. Okay, so this is my nighttime skincare routine for anti-aging dry skin. I'm 40 plus, so I'm following the anti-aging routine, which is perfect for 35 to 45. So this is about it. And for beginners, we should know vitamin C and ascorbic acid is one. It's one thing, different names. Then the vitamin A is the retinoid. Then these are the basic things which we should know. The humectants are your hyaluronic acid, and your aloe vera gel are the humectants. So about humectants, you have to keep one thing in mind, that whenever you are applying anything which has a lot of hyaluronic acid, or you're going for a hyaluronic serum, or you're going for aloe vera gel, both these belong to the category of humectants. So whenever you apply humectant on your skin, you have to make sure that your skin is soggy, and you should not apply it on your dry skin. So it basically locks the present condition of the face. So if the climate around you is dry and your face is also totally dry, and you apply the aloe vera gel or the hyaluronic acid on your dry skin, it's going to lock that dryness. So when you apply it on a moist face, it locks that moisture in. And this is a rule especially for dry countries, dry states. When you are living in a place like Lonavala, which is 7 months raining, when you're in a moist area, then even if you don't follow this rule, it will not bother you, because the product is going to take moisture from the around surroundings. So when the climate is not dry, then it doesn't bother much. But if you are in a dry state and your face is also dry, then you have to be very very careful when you apply hammock. So this is the important thing. Now, antioxidants. So vitamin C, the ascorbic acid, comes in the category of antioxidants, and actives are uh, alpha butene, azelaic acid, mandelic acid, uh, retinol, salicylic acid, lactic acid, glycolic acid, AHA, BHA range. So all these are actives, and you have to be very careful when you apply actives. You should not apply, couple of actives in a skincare in one single routine. You should have only one active in one particular routine, and you cannot apply retinol on Monday and salicylic acid on Tuesday and lactic acid on Wednesday and glycolic acid on Thursday. No. So ideally you go for 2 days retinol, and this is the basic routine which I am following, where I apply only so these are the substantial, like the solid strong actives: retinol, AHA, BHA. This is a strong like it belongs to a strong category of actives. So I apply only twice a week retinol. And when I go for a peel, now for example, I go for a peel on Monday, AHA, BHA peel or a lactic acid peel, anything. So if I apply a peel on Monday, then on Monday I don't apply azelaic acid or alpha butene. On Tuesday also I don't use azelaic acid and alpha butene. So no actives on Monday and Tuesday. And on Wednesday, if my skin feels absolutely fine, there is no sensitivity, there is no itchiness, there is no flakiness, my skin feels absolutely like my skin, normal skin, then I would go for a azelaic acid, because azelaic acid is the mildest active in my skincare, then the alpha butene, and then the retinol. So there are the three actives which I'm using, where only one strong active I'm using twice a week, which is the retinol. So in case I'm doing a peeling on Monday, there won't be any active on my skin on Tuesday and Wednesday, and when I apply a active on Thursday, that means after 3 nights, then that active will be azelaic acid. If my skin performs absolutely fine after azelaic acid, then next day I will go for alpha butene, and meanwhile I touch the strongest active. It's 1, 2, 3, 4, 5, 6th night I'm touching the retinol. So like this I space out my actives. So it might be confusing initially, but if you keep going through these videos, you will slowly start to understand the whole scenario. So remember, whenever you are applying actives, you should know what you're doing to your skin, and you should always understand your skin. If your skin is becoming flaky, itchy, sensitive, if there are certain products which goes on your skin are causing you any burning sensation, which was not happening few days back, that means there is some active in the skincare which is causing skin barrier damage, and that means you have to instantly stop using your actives and antioxidants. Just hydrate, hydrate, and hydrate. And looking forward to share more of these kind of information, and hope all this helps you. And trust me, if you understand skincare, if you understand these products, if you understand your skin, I swear we don't need facials for sure. Now things have changed. Physical scrubbing is outdated, and chemical scrubbing, chemical exfoliation has come into the picture, and there are a lot of changes in the skincare market. And I think we all should educate ourselves and become skin intellectuals. So skin. Uh, it's always good to know this is your body, this is your hair, this is your skin, and it is very very important to understand and take care of yourself without being scared of these products. Just understand your skin. If something is not working, hydrate, hydrate, hydrate. Go for I'll discuss what to do when your skin barrier damage, everything whatever I know I will try and share through my videos. Thank you so much. Stay tuned.